This is Vamshi Krishna. So in this video you are going to learn about the kardex form. So firstly the kardex form is nothing but which will give the health information of the patient. Okay, so what is the definition of the kardex notes? It is about the patient health information. Okay, so for that reason we will use the kardex form in the hospital. So firstly we will look at the what is kardex. Okay, what are all the components will be present in the kardex form. So first one is the date, medications, dose and time. So this is a one column. Okay, so this is a one column. So firstly we will see about this. So first one is the date. Okay, so on which date you have taken the patient. Okay, for example today's date. Today is the it's around about May 21st. So today you have taken the patient, that is 21 date, and the medications which the doctor has advised you have to write here. Okay, so all the medications you have to write here, whether it is IV, oral, okay, intradermal, subcutaneous, whatever it may be, you have to write about the medications name here. So next one is the dosage. So how much of the dosage has advised? For example 100 mg. Okay, 100 mg the doctor has advised. So for example paracetamol here 600 mg. So today is the 21st date, and the time, whether it is BD, TID or OD. So you have to write the drug name here and also frequency of the drug. Okay, paracetamol, BD means twice in a day, 2 times in a day. The dose is 600 mg, and time, for example 10 am and 10 pm. So this is the medications column: date, medication, dosage and time. So the next one is the nursing care plan column. So in this column you will see the nursing care plan. First one is the date. So same as it is here, you have to write the date and month and year. Okay, and then you need to write about the patient's care. For example you have taken the patient, firstly you go for the assessment. Okay, so before assessing the patient you should not go for the any procedure, any care. Why? Because by assessing only you can find out the patient's problem. Okay, by assessing only you can find out the patient's problems. Okay, first of all you need to go for the assessment, and then you go for the for example providing of diet. Okay, and then give. Okay, it's provide, it is just future tense. Okay, in the future you are going to do. So you have to write the assess the patient condition, and then you go for the provide. Okay, not providing, you are provide diet. I'm just giving examples. Okay, otherwise next thing is the provide dressing care. So like that, whatever the treatment, whatever the care you will give for, you are going to plan for the patient, you have to write here. Okay, and next thing is at what time you are going to do the assessment. For example at 8 in the morning you have received the patient, so you will plan for the assessment 8 o'clock. Okay, and then you go for the diet for 8:30. Okay, so at least 30 minutes it could be take for the assessment. So then dressing care, so after eating you may go for the dressing. It is about 9:30. Why? Because after giving diet directly you should not go for the dressing. Why? Because the patient may have the unfeeling well. Okay, so you go for the dressing care after 1 hour. It is just around, it is just based on your plan. I'm just giving example. So you have medications column and a nursing care column and a treatment column here. So now we will see the treatment column. So the date also you have to write here. Again you have to write the date. And the treatment is nothing but, for example, dressing. Okay, otherwise surgery. So the patient has posted for the surgery today. So today you have taken the patient. So the surgery also you have to write here. And dosage, if you give the IV infusion, okay, IV infusion, if you give the IV infusion, you have to write about the 100 ml, otherwise 1 liter, 500 ml, how much ever you give the intravenous fluid you have to write here, and also at what time you have given, so you have to write the time here. Okay, this is the treatment column, this is the medication column, this is the nursing care plan column. So this is all about the health information of the patient. So here if you come here, this is biodata of the patient. So firstly we will see the name. For example, Mr. X. So the patient name is the Mr. X. And then registration number. Okay, so registration number is nothing about the patient's ID. Okay, and then patient diagnosis. For example, the patient may have the fever. Okay, so you have to write about the diagnosis, pyrexia. But you should not write about the nursing diagnosis. Okay, hypothermia related to the disease condition. Okay, so like that you should not write. So you have to write about the medical diagnosis, that is pyrexia, and then doctor's name. For example, Mr. Y. The doctor's name is the Mr. Y, otherwise Miss Z. Okay, so whatever the name it is, you have to write here. And then IP number. IP number is nothing but the patient case sheet number. Okay, so 1 2 3 4 5 6 like that, the IP number you have to write here. And then you go for the religion. For example, if the patient is Hindu, means Hindu, otherwise if the patient is Christian or Muslim, whatever it may be, you have to write here. And then age. For example, the patient may have the 30 years of age. And the bath. So which type of bath the patient is taking? For example, tippet sponge bath. Why? Because the patient have the pyrexia. So you may plan for the tippet sponge. Otherwise, if the patient doesn't have the fever, the normal bath. Okay, normal bath, like that. And the next one is the temperature, pulse and respiration. Okay, so if the patient is advised by the doctor to check the, otherwise to monitor the temperature, pulse and respiration for 3 times per day. So if it is 3 times per day, you have to write Q3H. Okay, Q3H. If the patient have advised by the doctor 4 times, Q4H. Q4H you have to write here. And the BP, that is blood pressure. So BP has checked for the 2 times per day. So you have to write BD. So like that you have to write, but you should not write the blood pressure values here. Okay, temperature values here, like that you should not write. Only you have to write how many times you are going to check. And then diet. So which type of diet you are going to give for the patient? For example, soft diet, otherwise protein rich diet, otherwise low carbohydrate diet. So like that you have to write here. So this is all about the patient details, and this is about the health details of the patient. So this is about the kardex form. Okay, for every care plan in front there is a kardex form. It will give the complete data about the patient on the date. So on which date you have taken the patient, on the dates details only we will have here. For each shift, okay, for each shift we have to take the each kardex form. For example, the sister came on the morning shift, so she has to take the one kardex form. In the evening, that is afternoon, another sister came and she has to take the another kardex. And finally night shift, so in the night shift also she has to take the kardex form. So for each shift we have to follow the kardex form like this. Okay, so you have to write the kardex form like this. Thank you students for watching my video. Please subscribe and share with your friends who doesn't know about the kardex form.